So, as we said, that Vconnect Foundation strongly believes and advocates for the newborn hearing screening program, and it believes that each and every child born should be tested at birth. So, in our endeavor, we drafted a proposal for the newborn hearing screening program, which could be implemented in the 4 BMC run hospitals. Apologies, Dr. Chore, Mr. Chore. I am just going through the proposal, what we have submitted to the BMC. And we thought that this model then could be later implemented in the entire city of Mumbai. I would like to present some facts. I would like to present some statistics. The data from the National Sample Saver Organization says that hearing loss was identified as the second most common cause of disability in India and was the top cause of sensory deficit. India has 63 million people that suffer from hearing loss. 7% of people of India were born with a hearing disability, and out of which 291 per 1 lakh suffered from severe to profound hearing loss. 6 out of 1,000 babies born have hearing loss, and if they are not detected and intervened before the age of 2 years, this could have a lasting effect on their speech and language development. The Maharashtra census of 2011 states that Maharashtra has a total number of 4,73,271 people with hearing loss, and Mumbai has 78,964 people with hearing loss. This is way back in 2011. So why the need to develop this proposal? As mentioned, that in Mumbai city, there are various institutes or hospitals which carry out their own screening program. But in the absence of no mandate by the state or the nation, there is no standard protocol laid down for this process. So if we have the universal newborn hearing screening program becoming a mandate, this will help us fill the gaps in service and will help in the early intervention program. I will just briefly take you through the benefits, as everyone has reiterated that it will help in improved academic achievement, better social and mental health, improve the employability and thus the independence of an individual, and this thereby would reduce the economical and social burden on society. The goal of this proposal, which was submitted to the BMC last year, was to screen all babies born in Mumbai for hearing loss within 24 to 48 hours of their birth. Second step was to confirm the diagnosis of the hearing loss by the 3 months of age. To ensure fitting of a hearing device immediately after the confirmation of the diagnosis. And most importantly, to begin early intervention immediately after the fitting of an appropriate hearing device. This was the proposal that was put to BMC, which focused on mainly 4 areas. And Shri Chaure Sahab has already explained to us in detail his dream project. But I'm just taking you through these 4 pillars. Yes, we would need trained technicians to implement the hearing screening program. We don't need professionals. Equipments and consumables would be required as and when needed. We need a robust data collecting system. And as Chaure Sahib said, that COVID-19 pandemic was a blessing for us in many ways. The BMC has a massive data collecting system, and they did an awesome job in the COVID-19 pandemic. Lastly, and most importantly, we should have an annual review to ensure that the screenings done are being carried out efficiently and optimally. So, we sincerely hope and we are very sure after Mr. Chaure's speech of his dream project that this proposal would enhance whatever the dream of the Joint Commissioner is, and would also influence and educate and encourage policymakers to make the newborn hearing screening program a mandate, first in BMC hospitals, followed by Mumbai city, then the MMR, then Maharashtra, and then in the entire country. Now I would like to invite Dr. Sumit Mrig, who on behalf of the Cochlear Implant Group of India had submitted a memorandum to the center, to the health minister. Over to you, Dr. Sumit Mrig, to give us an insight on the memorandum.
Thank you, Fatima. Thank you, Vaishnavi. First of all, congratulations to Vconnect Foundation on your Founders Day and the excellent program. I'm actually very excited and very happy to hear Mr. Chaure. Congratulations to you, sir. Very, very scientific and very clear projects you have made, and with people like you with us, in this fight against deafness, I'm sure we all will be able to have a universal newborn hearing screening program. Uh, Fatima, as you know that 2 years back, before we were just pre-COVID, I was fortunate to meet the health minister along with the AOI president, Dr. Sameer Bhargav, and we presented a memorandum to the health minister, and we had a meeting called the next day. I am currently the executive committee member of CG, Cochlear Implant Group of India, and representing CG body uh, as a member to the Central Health Committee. So we have been little unfortunate of these waves coming in and out, but yes, the health minister, the health secretary has really assured us that they are going to take up this project and they want to implement this. So few key points which I will just share with you. It was a long meeting. So where are we right now? As everybody has reiterated the fact that we have lot many programs running. The program for prevention and control of deafness is running for last so many years. So where are we actually stuck up at? We are actually stuck up at that there are a lot of government schemes like RBSK program, many other programs, the EDIP scheme running. The problem is not that we are not getting implants to treat deafness. The problem is detecting deafness at the right age, which I think is the biggest roadblock in success in getting these children to enter mainstream education, in getting them into colleges, in getting them into universities of their own choice. So we currently in India, if we see, the average age of cochlear implantation is about 2 to 2.5 years, or maybe 3 years sometimes. We have to get this age down, and this can only happen if we do detection. Like you clearly mentioned that the entire program is going to be centered across detection of deafness, that you do screening at 1 month, you diagnose at 3 months, and you do intervention at 6 months. The only way which we think it can be made possible is only merging the universal newborn hearing screening program with the immunization program. I really excellent pointers given by Mr. Chore, but then we have realized that if this program is implemented with the immunization program, then it will be indispensable. It will be there will be no leakages, there will be no miscommunications. Every child in our country, whether in rural or the urban population, gets immunized now, and they can just check at the end of the leaflet. So we want to incorporate one more addition to the immunization program, is that OE screening. Now, this screening should be done at birth, possibly, preferably within 24 to 48 hours. And if we can implement this at the center, it will be implemented throughout the country. And I'm sure our efforts in getting these children into mainstream education will be absolutely, absolutely fruitful. There are other programs which we are planning, like how this can be done. So there needs to be integration with certain branches like ENT, pediatrics. So we are in touch with the Indian Academy of the Pediatrics, the Gynecological Association, the Anganwadi workers, the ASHA workers. So we need to implement this not only at the district level, as you might be aware that about 275 districts across the country are doing newborn screening program, but it is not available at every PHC. Then we did mention about you did mention about the 4 pillars of work. We need to do manpower training. We need to buy these equipments. We need to ensure that if there is a failure of a test, then the retesting is done at 1 month. So it is going to be a complete integration of branches like I mentioned. Along with that, the healthcare system should be arranged in such a way that even the basic Anganwadi worker or an ASHA worker or a midwifery can also be trained to just do an otoacoustic emission. Once we sort out this and we implement this into the immunization program, into the immunization card, then I think we would be at a very, very firm platform to detect deafness and implement and do an intervention at 6 months. And if we can get all these kids operated at 11th month or 12th month or maximum by 13, 14 months, I think our main stress point, I would say, or main problem, which is generally the therapy or the habilitation. Surgery is not an issue. It is just the 10% of the job what we do. And trust me, at my center, and I firmly believe that my lifeline is my audiologist and my therapist. It's not me. And we try and tell parents all the time that you bring your child early, you will see the results. There's going to be a massive difference with a child operated at 1 year of age and a child operated at 5 years of age. And I think the health secretary has understood. We are going to now, maybe in the next 2 weeks, I'm going to meet him again. We have a group, and you are aware about it, that Vaishta is a part of it. You are a part of it, and we'll be very happy to collaborate with you, take lovely ideas, excellent ideas from Mr. Chore, and we can put forward a proposal where this implementation is done at the center so that it is implemented pan-India. Thank you. Thank you, Vaishta.
Thank you, Dr. Sumit, for your valuable input. Now, I would like to invite Ms. Gayla Guignard from the AG Bell organization to give her perspective on the newborn hearing screening. Welcome, Gayla.
Thank you so much, Fatima. Let me just move this to the full screen.
You.
Here we are. I hope that everyone is able to hear me okay. And I first want to say what a pleasure it is to be here with all of you, and specifically to be invited to participate today by Vconnect. What a wonderful organization you have there in Mumbai, and the work they are doing is just impeccable. It's wonderful. The last 15 years and the impact that you've had on families, there are not enough good things that I could say about that. It's really an honor to be with you today. So I do have a background, in addition to being at the Alexander Graham Bell Association for the Deaf and Hard of Hearing in Washington, D.C., I also have a background as an audiologist and working in a newborn hearing screening program at the government level. And so I'm really thrilled to be able to talk about early hearing detection intervention. That's the umbrella term that some of us use to describe newborn hearing screening, because newborn hearing screening is really just part of the program. It is important to be able to screen, but there are many things that need to be done after the screening, as you know. So many of us look to the Joint Committee on Infant Hearing to look at how it is that a newborn hearing screening program can be set up and set up optimally. And there's a document that comes out every 10 years or so that is called the JCIH position statement. And it's an update because we learn things, we gather data, and then we make new decisions, and those decisions and recommendations go into that document. It's very, very helpful, and is really, I believe, used all over the world. Our organization, AG Bell, is a member of the Joint Committee on Infant Hearing. We have a professional who is an audiologist and speech-language pathologist who participates on that really important committee, and we also have a parent who participates, because it's so important to always have the parent voice present when discussions are happening around changing systems, policies, services, and making progress towards the future. So 136 is what the Joint Committee on Infant Hearing recommends. And in some places where they are doing such an incredible job by screening the hearing of all their babies by 1 month of age, and by getting that comprehensive hearing evaluation by 3 months of age, and then when a child is found to be deaf or hard of hearing, moving them towards early intervention by 6 months of age, some places are doing such an incredible job at that. It's a dream we all share. But some places are doing such an incredible job that the JCIH organization has recommended that where possible, even try to identify hearing loss earlier and get children into services earlier. So by 1, 2, and 3 months of age. Wow, that is something to aspire to for sure. So I want to talk a moment to just let you know where things stand right now with the US. We are certainly by far just one country that is doing newborn hearing screening. Many countries have newborn hearing screening programs in place, but because I am from the US and have worked with this program, it's certainly the one that I know best. But for many years now, about 20, we've been doing newborn hearing screening in a way that is supported by the government, and we can systematically measure our progress. And so where are we now? With our babies who were born in 2019. So in the US, we had 3.6 million babies born in 2019. Let me tell you how that compares to India. And I tried to look to see in your region, and I couldn't find the numbers, but in India, there are 25 million babies born each year versus 3.6 million in the United States. So while there's information that could be beneficial from the States, truly India, and that's what you're talking about today, has to attack this issue from the perspective that works best for India. But hopefully I'll be able to share some information that you will find helpful and that you may apply as you move along with programming. So in the States, for babies who were born in 2019, 97.7% of those 3.6 million babies were screened. So almost 98% of babies were screened. We do have many out of hospital births, a surprising number, but even the out of hospital births have a pretty high screening rate because we do have midwives who serve those families. So 98% is a good number, and those babies were screened by 1 month of age, which was our goal. Of those babies who were screened and who did not pass the newborn hearing screening. And again, the screening happens in 2 ears. It's very, very important, not just 1, 2 ears. We hear with both ears. So whatever you do, when you do a screening program, it's important to screen both ears. So for those babies who failed their newborn hearing screening, almost 80% of those babies were diagnosed by 3 months of age. That means their hearing status was confirmed. And when I say that, not every child who fails their hearing screening is actually does have a permanent hearing loss, but the benefits of finding the children as early as possible, they're so vast that it is really important to make sure you screen all those babies who do not fail. Who do not pass those early screenings. In terms of the children who are found to be deaf or hard of hearing from this group, 72% of the children were in fact enrolled in early intervention by 6 months of age, which was the goal. So I'm sorry that my percentage cut off on this screen, but I wanted to just point out that just as anywhere, the United States struggles with loss to follow-up. Once a child leaves the birthing facility, or even the family moves beyond that first week of the child's life, they get busy again and they go back to their regular schedule. It can be very difficult to find the family. And that's an important and very individualized solution that you have to put into place to be able to find those families. I'll tell you that for sure. But of all the children who did not pass a newborn hearing screening, so 61,475 babies, of those babies who were screened, which was about, nearly it's over 3.5 million babies who were screened. But a small number, 6,000 and some change, so 6,000 plus, were found to have permanent childhood hearing loss that year. So 10% of the babies. Very, very important again to find those babies early. It really changes their life to be identified early. Of those children who have hearing loss, again, 62% of them were eventually enrolled in early intervention services, whether those were government services or non-supported government services. We want to see that, and when I gave you the number earlier, it was higher, it was about 80%. Not all, that's just of the children we find who actually go into early intervention. The real number is that about 62% of the children who are found to have a hearing loss, to be deaf or hard of hearing, actually are documented to get into early intervention. So that is a concern to us and a number that we have to continue to work on in the United States. Some components of a newborn hearing screening program. As you're thinking about it, as I mentioned before, you want to screen hearing in both ears within 1 month of birth, and you can certainly do it at 12 to 24 hours after birth is terrific. It's ideal. Also, you need to be doing a follow-up hearing evaluation within 3 months of age by an audiologist or someone who is a specialist in evaluating hearing. And then hearing technology, hearing aids should be fit within 1 month of that diagnosis. And then early intervention, certainly within the first 6 months of life. And we have data from Dr. Christy Yoshinaga-Otano. Many of you know Christy. She has presented several times in India, but she did a study several years ago now. It's been going towards 30 years ago, looking at all the children in the state of Colorado, and saw that those children who were identified before 6 months of age versus the children who were identified after 6 months of age had a different trajectory in terms of the progress they made. That those children who are identified early, in particular, have a easier time and they're more likely to arrive at school age with age level language skills, and they're ready to go on to the neighborhood school. If a child is identified late, does that mean all is lost? No, of course not, because there are so many important factors that can be put into place, and especially the child's parents and the family. When we think about the 3 most important aspects in a child's life, when that child has been diagnosed as deaf or hard of hearing, the 3 most important aspects: the family, the family, the family. The family is the wind beneath the wings of that child. That's one reason that we have family support listed as an important component of any newborn hearing screening program. Parents have questions. Parents are often in disbelief, as indicated earlier. Parents are confused. Parents need guidance, and they need trusted guidance. And again, I cannot emphasize enough how important programs like VConnect are to families, because they are a light in the darkness. Most families have no experience at all with deafness. And so they need someone to help guide them, and VConnect can do that. Also very important to an EDI program is the EDI tracking system, the data tracking system. It is very tough to find children if you do not have a systematic way to track your program. And so that's important. And there are canned systems that are available, but you can also do homemade systems as well. And then medical home integration, bringing the child's primary care provider into the conversation so that that provider can help support the family, and also make sure that the child is being evaluated in all of their developmental domains, and that development is moving along as expected. And then, of course, ongoing monitoring of the child's status in preparation for school and life. So the most important messages regarding early hearing detection and intervention, the most important is making identification of hearing loss and the follow-up systematic, indicating this is the process we're going to use, these are the procedures we're going to use, so that you can find every child and know how committed you are to that. Also making identification follow-up occur as early as possible. Not every child who has a hearing loss is born with that hearing loss, but for parents to know the signs of hearing loss can be very helpful and get them to the right place. And then last would be designing a system that works for your country, your region, your locale, your population. The people to always include, I hope you'll include, and I know you are, the professionals at VConnect have lots of experience and know what families are going through, and also know where there are issues in the system. But these are the kinds of questions that you would want to ask as you are fashioning and making your system work for you. At any time, I'm glad to be a resource. I have enjoyed having a relationship with the Hishai and with Fatema and over time, and I even have put my WhatsApp number in case anyone wants to WhatsApp me, because we are always here to help. Thank you for the opportunity to be here and to speak, to participate today.
Thank you, Gayla, for your valuable insights. Now I would like to invite Mr. Brian Lamb to give his perspective on the newborn hearing screening program. Welcome, Mr. Brian.
Hello, everyone, and welcome and congratulations to VConnect on your 15th anniversary and for the hugely important work that you do. And we're aware of that through your really supportive membership of the Cochlear Implant International Community of Action, for whom I'm talking on behalf of this evening. But it really is a privilege to be here. And I was asked just to share very briefly some of the learning from the UK, and also how that has implications, I think, for the incredible project you're on, and some learning perhaps about just how not just important newborn hearing screening is, but how economically effective it is for your society, as well as beneficial for the individuals that are part of all of that. So I was just asked to talk briefly about the experience and cost effectiveness of the UK Universal Hearing Screening Programme. And we're very lucky to have had a pilot in the UK from 2001. And by 2017, that programme was achieving over 90% coverage in the UK. And as other speakers have already said, some of the crucial benefits of that programme that we've been able to see over those years is improved early intervention, increased receptive language score, which is crucial, as was being said by a number of other speakers, in terms of the sooner you can get children's language and communication back up to what it might have been, the more chance they're going to have of participating in education, the more chance they're going to have of having the same kind of trajectory in life and in employment as anybody else without hearing loss. We've seen reduced overall educational costs across the system and improved longer-term prospects for children with hearing loss, which is very much in line with experience in other countries. If we look at the UK situation and look at the cost effectiveness of that programme, a very important study was done. One of the beauties of having had newborn hearing screening in place for so long is we've been able to study in some precise detail the effects and the impact of that programme. And the best estimates of annual cost saving because of universal hearing screening in a middle school child is 21% of the neonatal cost of having that screening program in place. That means if we took that annual cost and generalized it across the whole period of that child's education, that alone would support the cost of the newborn hearing screening. So essentially, what researchers said is that actually by implementing universal hearing screening program, it's actually saved in educational costs, the cost of the program across the whole system. Another very important study, because we've been going for so long, you can get a very large number of children into these studies. So a study of teenagers from a birth cohort of 157,000 children just across southern England who had received newborn hearing screening showed that they had better reading comprehension than a control group from the same cohort who had not received UNHS. And again, the crucial point about that is it shows the effectiveness, as you've been discussing, of the early intervention on the language acquisition of those children, the reading comprehension that follows from that, and therefore they make up any of the deficit they might have had because of their hearing loss and can actually perform at the same level. And that means that for each measurable unit of receptive language that those children had, so the better they did at getting that language acquisition, actually decreased the cost of extra education that would have had to have taken place by 1,616 English pounds. So again, that shows very, very clearly that actually the actual program is cost effective and therefore actually pays for itself in terms of the investment into that. And if you want to look up both those studies, the previous speaker mentioned the excellent work by Christine. She's actually done a review of the outcomes of universal newborn hearing screening programs, a systematic review across the world. And those two studies are featured in that program there. The other crucial thing I think we need to understand about universal hearing screening is not only does it therefore allow the education to catch up for the child's language acquisition and reading acquisition not to be impacted upon, but it allows the early intervention that other people have been talking around in terms of ensuring that children get hearing aids early and also get cochlear implantation where that's indicated early. And again, a study was done in the UK of the benefits of that very early intervention and over children that were not implanted versus those that did. And it found a saving of 44,000 euros by the early implantation of those children over children that were not implanted. So again, the ability to early intervene doesn't just save money on the screening program, but it also means that the cost savings of having the early cochlear implantation and the benefits that leads to, again, in terms of early acquisition of language, being able to go to mainstream classes instead of needing special education, to be able to go on and access language and have employment, is a saving of 44,000 euros. Now, the cost of the implant operation in the UK would be less than that. So again, it's an overall saving for the whole system. And therefore, the whole conclusion in the UK has been that universal hearing screening has been cost effective, both in terms of saving more money than the program actually costs, in terms of the overall trajectory of those children's lives. And many of these cost-effective studies don't even include the overall economic impact across the whole life of a child in terms of being able to do that. So we think the savings are even much greater than the ones I've indicated here. And they're also very much in line with other international studies that have been done. And I just thought I would end on these two summaries from the World Hearing Organization. And they did a very important modeling of interventions for hearing loss. And they also found that in China, there's been a cost benefit of 1 to 7.52. So for every unit of expenditure, they're getting a cost benefit of 7.2 back in China. And there's been a study in India that I wanted to share where they estimated lifetime savings were more than 500,000 US dollars per child identified with hearing loss. So I think it shows there that there is a massive potential impact of implementing universal hearing screening for children, but also for the economy and the cost savings for society. And therefore, just to finish, who also estimated that in lower middle income setting, there'd be a possible return of 1.6 international dollars for every dollar invested. So I think we can see whether we're looking at the UK situation or how that might translate into the Indian situation or other countries' situations. Investing in universal hearing screening is an absolute saving in terms of society. It's an absolute benefit in terms of the impact on children and on families. And I thank you very much for allowing me to have time to share those figures with you. And I wish you luck in what incredible program that's been outlined this morning. And I only hope that's implemented and adopted as soon as possible. Thank you very much.